Hi, welcome back. I'm Beth Haynes. This week, singing sensation Susan Boyle announced she has Asperger's, a form of autism. The Britain's Got Talent singer told British newspaper The Observer she went to a specialist last year who diagnosed her. As a child, she was told she had brain damage. Boyle told the newspaper she hopes the announcement will lead people to treat her with more understanding. And joining us now with more on Asperger's and what it is Dr. John Kupfner, a psychiatrist from Peninsula Outpatient Services there. And we really appreciate you being with us. And I want to begin by defining what Asperger's is. We often hear that it is on the spectrum of autism. Is it considered a type of autism?
The diagnosis of Asperger's is changing next year, so it will be included in what we call autistic spectrum illness. So it can be viewed as a mild form of autism, or it's equivalent to what we also diagnose as high-functioning autism. So it's a mild form of an autistic illness.
What are the most common symptoms with Asperger's?
So when I talk to parents about this so they can understand if their child's been diagnosed, this is usually something that is picked up, and these days, early in childhood. This is a social and communication disorders, so they're kids that have a hard time understanding nonverbal communications, so that they really have a hard time with their peers. They don't understand things that aren't logical. So as you move in childhood into an older phase where kids start to be sarcastic and make jokes, like these kids kind of fall behind, they appear immature, they become obsessionally into things. So like, good examples are like, they do the normal things kids would do at that age, but they're just a little way too into it. So they may be into Thomas the Train, but they're way too into Thomas the Train, and Thomas the Train is all over the room, and they may watch the same episode 150 times and seem to enjoy it every single time. They get into dinosaurs, they're just way too into dinosaurs. So they really take their interest to an obsessional level, and that sets them apart from their peers, and they can be ridiculed and made fun of, because once you get to the third and fourth grade, kids start to separate out and make fun of each other. So
is it typically a later diagnosis for Asperger's, maybe late childhood?
These days it is. So Asperger's was first described as this syndrome in sort of the 1940s and wasn't publicly accepted until the early 90s. So that first wave, there were a lot of adults that were reading about it and saying, you know, I've struggled with understanding other people and communicating, and it's gotten me into bad situations, and I sort of have some of these anxieties and fears, and so we were picking up a lot of adults. But nowadays I'd say it's more commonly picked up in childhood.
Talk about the treatment for Asperger's.
You can be very high functioning. Some people don't need any treatment other than just to understand what they're struggling with, that they need a partner or people or family around them that understand to communicate in concrete ways and not use a lot of hyperbole or suggestion or sarcasm when communicating with them, because it may be confusing to someone with Asperger's. Like, if I was talking to you and you were smiling at me right now, but maybe you were not really happy, that would be very confusing as to why you'd be smiling at me if you were not happy. And if you later expressed you were not happy and expected me to intuitively know that, I wouldn't. So it is hard for people around folks with Asperger's to learn how to communicate, because there's a lot of nonverbal communications, like I just did with my hands, just a natural part of conversation. So they tend to have more structured, kind of highly formal language.
Any idea what causes Asperger's?
Well, it's something that you're born with. This is a developmental. Right now they're classified under developmental disorders, but it's a developmental issue in the brain. We're actually making a lot of breakthroughs there. You can see changes in the brain on functional MRI and PET scans. These are very expensive exams, not paid for by insurance, not commonly used, and pretty much delegated right now to research institutes. But you can see changes in the brain when folks with Asperger's, and it's the way that they interpret their environment.
Yeah, and we talked about Susan Boyle saying that she was told originally she had brain damage. Talk about just how far the diagnosis and treatment has come.
It is really accepted now. It's accepted by state agencies, schools, insurance companies, and so people are really beginning to understand that this doesn't mean that there's something wrong with a person. It's just a different way that they have of interfacing and interacting in their environment. So they like to be really controlling of their environment. They get a lot of anxiety if they have a lot of changes throughout the week. So if, for instance, we work 5 days, take 2 off, and we look forward to that. If you have Asperger's, like every single week when you go from working certain hours to whole day off, like that's a change of week. That can produce a lot of anxiety, so they like to control.
Change is very difficult.
That's like one of the fundamental problems is in Asperger's, is getting the person, patient, whatever, to be able to accept a rapidly changing environment,
And
especially
adapt to that, too.
and
That's very
especially in 2013 with computers, technology, and all the multitasking we're expected to do. Like, we live in a rapidly changing environment.
Goodness. Well, thank you so much for giving us a better understanding of Asperger's. Appreciate you coming on.
Well, thank you.
All right, and we're coming right back after this.